Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Markham.
Good evening and welcome to Heart of Health Live, where you are the guest. We have a very interesting and informative program today. We have a neurologist with us. In case you don't know what a neurologist is a physician that's trained in diseases of the mind. And specifically, we have Dr. Tarek Kadri with us, and he's from the Chattanooga Neurology Associates. I might not have said that right, but he's going to be with us answering your questions regarding especially sleep apnea. That involves the mind. So if we want to talk about sleep apnea tonight, other questions, we'd be happy to. We want you to join with us. Our phone number is 855-644-3278, and we're so glad you joined us tonight. What's in the news today? Well, a lot of things have been hot in the news lately, and I pulled up some of these. And here's a study from the European Heart Journal where it says heart attack spouses also need care. You know, heart's very dear to me as a cardiology. And did you know that spouses of people who have a sudden heart attack are at increased risk for anxiety, depression, suicides, and even subsequent heart attacks after the event? So when someone comes to me with a heart attack, I should probably pay equally attention to their spouse. Likewise, you should do the same. Another interesting article from Neurology comes that says that obesity may speed up mental decline. And this just came out Tuesday. It says, combined with high blood pressure and other metabolic factors, people who are obese in the middle age, that means carry extra weight, unfortunately many of us do that, experience a more rapid decline in cognitive skills in thinking and memory. So that's another good reason for us all to get out there and do some exercise, because we want to keep our mind sharp. Now here's one that I thought was very interesting for those of you who called in regarding marathon racing. This study had to do with, is it safe for people over 50 to run marathons? We've talked before about this, how people that are at middle age increase their metabolic stress, increase inflammatory markers when they exercise a lot. Well, this study that showed that people that run these marathons, 26 miles that is, actually damaged their right heart, but their right heart got better after a week of rest. Now, I don't run marathons, but if you do, luckily this study from the Journal of MRI showed that your heart will get better after you rest for about 1 week. So those are some of the interesting things in the news out there today. Also, everyone's talking about the West Nile virus and how there's neuro involvement. And we'll talk about that along with your other questions regarding sleep apnea right after the break. We're with Dr. Kadri. We want you to join us. Our phone number is 855-644-3278, or you can join us at our website. That's heartwiseministries.org. We'll be back with Dr. Kadri right after this break.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
Hello, I'm Joe Coaches. If you enjoy Heartwise Ministry as much as I do, you just might want to become involved. We would first really appreciate your prayer that God would continue to bless and lead this unique ministry. Also, it is very important that you think about becoming a financial partner supporting us so that we can take this message throughout the world to everyone. Thank you.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. I'm Dr. James Markham, and I'm so glad you've joined us tonight. And we want to leave you tonight with one or two good things that you can remember to help you sleep better, to help you feel better. And also, if you might be one that's out there that needs to see a physician or need to get some help, we don't want you to sit at home and hurt yourself. Dr. Kadri, welcome to Heart of Health Live.
Thank you for having me tonight.
Now tell us, what got you interested in the field of neurology?
Well, I think the first thing that got me interested was my interest in neuroanatomy. In the first year of medical school, I was interested in neuroanatomy and fascinated by the mind and how we knew so little about the mind,
Right.
and how so many of our, much of our research was going to be focused on neurological breakthroughs in the coming decades. And we're an aging population, and most of us, unfortunately, are afflicted by neurological problems, and it sort of fascinated me.
You know, it seems like we know a lot about some of the organs, other organ systems, but the mind is still an expanding universe.
It is. It is.
Now, how long did you have to study? You know, what kind of training did you have to get?
I went to undergraduate,
Right.
which was 4 years, and
Okay.
then medical school was
Okay.
another 4 years, and then I did an internship in general medicine for
Right.
a year, and neurology for 3 years, and then I did a fellowship for another year.
Wow.
So,
Now, did you do a fellowship in any special aspect of neurology?
sleep medicine and
Okay.
electrophysiologic testing.
Yeah. Now, what are some exciting things that you've learned about sleep? I mean, you know, it's sort of a expanding field right now.
I think the most dramatic thing that I learned very early on is how sleep can affect many other disciplines in medicine, and how it has a true effect on morbidity and mortality. And I don't think I realized that before I, really started to study and learn.
Yeah, it's real fascinating. Now, how long have you been in private practice now?
About 10 years now.
10 years. So you've been out for a while, and
Still learning.
yeah, you know, I think I learned more once I got out in practice than
I
I
know
did,
I have, yeah.
did that I did in practice. It's very fascinating. We want to invite our guest tonight. If you're watching, we want to give Dr. Kadri a call, 855-644-3278. And we're just glad you're here with us.
Thank you, Harry.
You know, when you think about mental health, you know, right now that they estimate up to 30% of all people have depression. What would you say the estimates of people that have sleep problems and sleep apnea might be?
It varies. It's more common in men than women. I think at least 5%. Now they're saying probably 10% of the population, males, have sleep apnea, and probably 60% of that, maybe 5 to 6% of the female population have sleep apnea.
Now, exactly for those that don't know, what is sleep apnea?
So sleep apnea is a condition where the airway obstructs and closes off during sleep, and it prevents airflow, and it causes disruption in sleep. So your typical patient with sleep apnea, there are three symptoms. Primary symptoms are going to be snoring, non-refreshing sleep, and daytime fatigue.
Okay. So the person that comes to you that you think might have it has those three things?
For the most part, right. Sometimes they may not endorse all of those symptoms, but they may have a bed partner that actually has witnessed pauses in sleep that look like it appears that they're having apneas, or it may be a patient that has morning headaches, or it may be the cardiologist that is seeing a patient and wondering why there's premature heart disease and trying to figure out what risk factors they may have.
Right. Now, so if a person thinks they might have this, and you said there's so many, you know, we didn't hear about this 50 years ago. What do you think is causing all this?
There's certainly one of the main risk factors for sleep apnea is obesity,
okay.
And unfortunately, as we all know, we're becoming a more obese nation.
Okay.
I think we're learning again about how sleep apnea can affect other avenues of health. It can contribute to heart disease, stroke, diabetes, weight gain. So we're looking for those patients more often as well.
Okay, well that's very interesting. Now, so a person comes, you think they might have sleep apnea. Did you give them, what's the next step after that? Do they need testing, or do they get anything else, or do you just say, you got it and tough luck?
So we take a history. I think in any field of medicine, that's the most important thing. And if we feel like they have considerable risk for sleep apnea, we'll oftentimes send them for a sleep study.
Okay.
And usually it consists of 2 nights of testing in a controlled environment. First night will be to observe breathing, heart rate, brain waves in sleep to see if they have sleep apnea. The second night will often be one of the main treatments we use, which is CPAP, which is a device that delivers.
I'm going to stop you right there. After a break comes back, we have a question that's come into our website, one that you've sent in, a person that's a little bit scared of getting a sleep test, so we can go into this a little bit more detail. So we've talked about sleep apnea. If you're snoring, you're not getting good rest, or you're quitting breathing, this might be an indication that you're the 1 in 10 people that might have sleep apnea. If you have a question for Dr. Kattery, give us a call, 855-644-3278. Stay with us. We're going to break.
The Heart of Health Live will return in just a moment.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
So here's a question. If you love Jesus, and I mean truly love him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what LifeTalk is all about. You see, at LifeTalk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing?
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back. I'm so glad you stayed with us. We're with Dr. Kadri today. He's a practicing neurologist in the Chattanooga area. We're so glad that he's given his time to answer your questions. Unfortunately, there's a lot of people nowadays that can't afford to go to the doctor. They can't go to urgent care, but you can get your questions answered here. We're not selling a product. We're not trying to sell anything. We just want you to get some good care, and if you need help, we want you to do it. Last segment, we talked about sleep apnea and the dangers that it is and some of the possible symptoms you might have. And we have a question that's come into our website, and that question is this. He says, my doctor says I need a sleep test, but I'm scared. What is involved with a sleep study? So Dr. Kadri, someone needs a sleep study, but he's scared. So we talked a little bit about last section. Let's sort of walk that person and see if they need to be scared about this.
Sure. So the first thing we'll do is we try to reassure them, try to explain, what's going to happen through the process. The sleep studies are performed in a controlled environment,
okay.
And we have them come to the sleep lab, which is generally affiliated with the hospital.
Okay.
They're monitored. We explain what's going to happen to them. We try to make the sleep environment close to equivalent to what staying at a hotel would be like. We know there's a lot of resistance to that because we sleep best, we're most comfortable in our own home environment.
Right.
So a lot of the first hour or so is really involves talking with the patient, counseling them, explaining what's going to happen. Then we hook them up, and what that involves is it involves a limited EKG. It involves some electrodes on the head to measure brain waves. And an apparatus to measure snoring and breathing, and some bands to measure breathing as well, and some electrodes on the body to measure movements in the body, which are something we also monitor in sleep. And then we simply have them sleep there. They have their own private room with their own private bathroom. We have infrared cameras, and they have a button to push, and we're available if they have any questions or concerns.
Wow.
Sometimes we'll use a sleep aid, a medicine,
okay.
Only if they have a ride home. We don't want them getting in a car if they're not used to taking a sleep medicine.
So do they get any needles?
No, no needles. No needle sticks.
Okay.
We try to duplicate their home sleeping environment as best we can, minus the apparatus that are stuck to their body, but no needle sticks.
I think I would be a little nervous, all these people watching me and hooked up. I don't know if I could go to sleep real quick.
And that is a concern, and most people were able to capture enough sleep. Again, we will use a sleep aid, a medicine, if necessary. One will be available. We certainly know that we're not going to be able to duplicate the home sleep environment exactly, but we're able to capture enough sleep to get a window as to what probably will be happening in their own home environment.
So let's say they're all hooked up, everything's gone good, they go to sleep, and you start collecting data, right?
Right.
And what's this data tell us?
It tells us about what stages of sleep they're in. It tells us, because what a lot of people with sleep apnea have is a limited amount of deep sleep, and that's why they have disruptions in their sleep, so we have to monitor their brain waves.
Okay.
And we also measure their breathing. That's how we measure what an apnea is. It's an obstruction of breathing. We monitor their EKG. As a cardiologist, you know that they can have heart rhythm interruptions.
Right.
Sometimes arrhythmias that occur that are triggered by some of these breathing events. Okay. We also monitor limb movements. There's a condition called periodic limb movements of sleep, which someone has abnormal movements and they sleep, and it can also disrupt the quality of their sleep.
Wow, so you get a lot of data in a short period of time.
Right.
Now, how long do they have to stay asleep to get all this data?
Well, the more the better. We say that at least 4 hours of sleep. Most of our patients probably get 6.5 to 7 hours of sleep.
Well, that's pretty good.
Yes.
And you serve them breakfast the next morning?
Most of the time, yeah.
I'm just giving you a hard time. Well, that's very interesting. So really, it's nothing more really to be scared about.
Now, most of our patients do just fine. Some people have some anxiety. We might let them watch TV and relax, and when they feel comfortable, we proceed with the sleep studies.
Now, do you get the information from these monitors? Is there someone actually looking at these monitors while they're asleep?
Yes, every brain wave, every heart rhythm, every movement is monitored. Okay. It is a dark room with an infrared camera, so there's not light, but we're able to monitor them.
Okay. Well, we hope that answers your question a little bit about what a sleep study is. After the break, I think we're going to answer some questions that might come in, that you might have for us at 855-644-3278. And also, I'm curious, now that we have all this information, what diagnosis and treatment might be reached. We're talking about sleep apnea with Dr. Kadri. We're going to be right back after this short break. Stay with us, please.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
So here's a question. If you love Jesus, and I mean truly love Him, people will notice, right? I mean, if Jesus is at the center of everything you do, people will have to notice. And that is exactly what Life Talk is all about. You see, at Life Talk, our goal has always been to connect people to the true source of power, Jesus Christ. We know with Jesus at the center of our lives, nothing is impossible.
You can easily spend $90 on an expensive meal out. How about investing $89.94 in your future? Just think about the possibility of coming off those prescription pills and getting rid of all the side effects. Think about feeling better than you have ever felt in your life. This is all possible for you. For only $89.94, you will receive a 7-part DVD series, Weight Management by the Book, a 30-lesson workbook with over 100 recipes, and if ordered today, exercise tubes will be included for free to help with your journey. There are many programs available, but this unique program has identified the truth about how to manage weight. This program is not available in stores. This limited offer will not last long. Pick up the phone now and dial 877-504-9628. Operators are standing by. This call will change your life forever.
Hello, I'm Joe Coaches. If you enjoy Heartwise Ministry as much as I do, you just might want to become involved. We would first really appreciate your prayer that God would continue to bless and lead this unique ministry. Also, it is very important that you think about becoming a financial partner, supporting us, so that we can take this message throughout the world to everyone. Thank you.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back to Heart of Health Live. We're talking about sleep apnea with neurologist Dr. Kadri. And if you have other questions, we also can have that. And we've got a question now from Sarah in California. Sarah, you're on with Dr. Kadri. What is your question this evening?
Well, I had one of those sleep tests, and they told me that I had a mild case, and I have declined treatment because I didn't want to wear a mask. And I was just wondering if there's any other good options.
Sure. So CPAP, which you're referring to the mask, stands for continuous positive airway pressure. That's the primary, that's what most of our patients use for treatment. There are more options, especially when a case of sleep apnea is in the mild range. One would be seeing an ear, nose, and throat doctor. Many people with sleep apnea have a narrowed airway, and there are some surgical procedures, the most common one being a uvula palatal pharyngoplasty, and if there's any nasal obstruction.
I'm going to stop you there. That's a pretty big word, but what's that mean?
It just means that the throat is narrowed.
Okay.
The uvula is the piece of the throat that hangs down. The palate is sort of the roof of the mouth, and the pharynx is the back. So basically, they just kind of remove tissue, excess tissue in the throat. And then sometimes people have a nasal obstruction, and the ear, nose, and throat would address that as well. That would be one option. For people with mild sleep apnea, sometimes an oral appliance that their dentist would make for them would be another option.
Okay.
And that is a device that mechanically alters the jawline to try to open up the airway as well. We see people with some forms of sleep apnea that are positional in nature, so we do monitor positions. So some people only have apnea when they're on their back.
Oh, that's good to know.
So we can position them on their side. We can put a tennis ball in a sock and hook it up to, and place it on the back of their shirt, so that if they ever turn on their back, they'll be forced to turn on their side. So those are some other options. And some very mild forms of sleep apnea don't necessarily require aggressive treatment if there are no risk factors.
Okay.
If you were only having the sleep test for snoring, and you weren't fatigued, and you weren't sleepy, and you didn't have high blood pressure, you didn't have diabetes, or didn't have any of those risk factors that we talk about, then we don't. It's not necessarily as urgent to be actively treated. Now, of course, most people that go through sleep studies have those risk factors or those symptoms.
Hey, Sarah, why did you quit wearing your mask? Was it too big? Did it bother you, or what was the problem?
I just couldn't stand something on my face. I would pull it off and wouldn't last through the night.
Now, what would you say to Sarah, Dr. Kadri?
Well, I would want to make sure that she tried some different interfaces to try to wear her CPAP mask. A lot of people use nasal pillows now, which are not bulky, they just fit in the nose. But we do realize that some people are intolerant of, they might be claustrophobic, or they might have tried 8 different kinds of masks and just simply don't tolerate the CPAP, and that's why we have other options.
Now, what percentage of the patients would you say that can't tolerate the mask?
Probably, in my practice, I would say it's about 15% cannot tolerate CPAP.
Okay, and then usually one of these other methods usually can help them out
And
with?
it depends on the severity, it depends on the case, it depends if it's positional or if it's moderate or greater, then really oral appliances are not a viable option. So if it's mild, there are more options.
Sarah, what do you think about all this here?
I don't know. I think I might look into some of those other options.
You might check into that?
Yeah.
Okay, well, we want to thank you for calling us.
Thank you.
Thank you.
Okay, so treatment, lots of things besides the mask. Now, I heard the masks are getting a lot more comfortable.
They are. It's like new cars. It seems like every few months there's a new mask that meets a different facial type or a deficiency in some of the other mask types or fits. So 10 years ago, the compliance rates were a lot lower. So.
And a lot of people, I don't think, understand, and we want to make this point, how if you go a whole night without oxygen, whole night, it's like living underwater. You're sleep deprived. You can't breathe. You come up, take a deep breath, and go back under. And when you do that, all the adrenaline, the cortisol, the inflammatory markers, the interleukins, all that goes up. And if it happens year after year after year, you get some serious organ damage.
Sure.
So if you can get treated for this early, you might prevent high blood pressure, problems with your lungs, problems with your heart, all sorts of medical problems. So if you have another question, we want to thank Sarah. Give us a call, 855-644-3278. You're watching Heart of Health Live. We're here with Dr. Kadri. We're going to be back answering your questions right after this break. So stay with us or go to our website. That's heartwiseministries.org.
The Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
Hello, I'm Joe Coaches. If you enjoy Heartwise Ministry as much as I do, you just might want to become involved. We would first really appreciate your prayer that God would continue to bless and lead this unique ministry. Also, it is very important that you think about becoming a financial partner supporting us so that we can take this message throughout the world to everyone. Thank you.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, and we're so glad with us tonight we have Dr. Kadri. He's been talking to us about sleep apnea. Now, I must ask you a personal question. When you're talking to a bunch of people that can't sleep well at night, are you able to sleep well at night? I think if I knew all this, I might not sleep so well.
I do sleep pretty well. I don't allow myself enough sleep time, which is one of the things I tell my patients to do. Is we're a sleep-deprived nation, so
right.
I'm guilty of not getting enough sleep, like most of my patients.
Yeah, I think we talked about all the problems that we get from sleep apnea, and this is something that if we catch it early on, we can prevent a lot of downstream problems.
Sure. Yeah, so sleep apnea, there have been many studies that have linked sleep apnea to high blood pressure, harder to control blood pressure, heart disease, diabetes, neurological disease such as stroke and memory disorders.
Right, so if you're out there, you think you might have it, you hear one of these symptoms you're concerned about, someone says you're not breathing, get help. See if you might have sleep apnea. We got another call calling from Oregon. Danielle's waiting to come on. I haven't got the flashing light yet, but in a second we're going to have a guest from Oregon. She's not quite ready with us yet. Now she's ready. Danielle, welcome to Heart of Health Live. You're talking with Dr. Kadri. What is your question this evening?
Well, thank you for taking my call. I just tuned in, so I'm not sure if you've already covered this or not, but my question has to do with my husband's snoring. He snores up and down the scale, and I am just wondering if maybe there's something that is that's causing that or affecting that, that I should have him take a look at.
Okay, Dr. Kadri, snoring.
So snoring is, most people with sleep apnea snore, but not everyone who snores has sleep apnea.
Right.
So certainly if your husband snores and his sleep is non-refreshing, or he's fatigued during the day, or you witness episodes where he stops breathing in his sleep, those would be concerning for sleep apnea. Snoring is caused by vibration of airflow through the airway, and that can be caused by nasal obstructions, people that have a deviated septum if they've ever had nasal trauma, or if they have enlarged tonsils. or a uvula that hangs down, air goes down the airway and vibrates, and that's what causes snoring. So that the concern would be if he snores and has those other related symptoms, that would be something that you probably seeing a sleep specialist would be warranted.
Now, have you noticed, Danielle, any of these other symptoms?
Well, you know, it's not an even snore, but I was just thinking as I was listening to him that maybe I should just tape record it, and then I'd let my husband assess it further.
That would be helpful. Sometimes if they don't have all the other symptoms related to sleep apnea, a simple, inexpensive test to maybe convince your husband that he might need to be checked out further would be something called an oximeter.
Oh yeah.
Where you actually take an oxygen clip and you wear it, and it measures your pulse and your oxygen in your home, in your own comfortable home environment. And if it shows desaturations or drops in the oxygen in a certain pattern, that could be consistent with sleep apnea.
Now, what type of patient would you put an oximeter on without doing a full sleep study on?
Maybe someone that didn't have a lot of the symptoms but snored like your husband, or maybe someone that's reluctant to see the doctor. They just won't see the doctor, or they're homebound. Those would be the types of patients.
Now, would he have to see the doctor in order to get that?
Can you get it at the drugstore?
You can't get it at the drugstore. You need a doctor's prescription, but his primary care physician might, with that history, even a phone call might order an oximeter, and that's something that could be delivered to him at the home and picked up the next day. And he wouldn't necessarily have to see the physician, but his physician would have to probably feel that even a primary care physician would feel that study would be warranted.
Okay, Daniel, I hope that answered your question, and I hope you can get a copy of this program for your husband, okay?
That was great. Thank you so much.
Okay, well, thanks for joining us. You know, that's very interesting. A lot of people have questions about this subject, and unfortunately, sometimes they're not always answered in an office, so this is a great avenue where that was a great question. A lot of people snore.
Fantastic.
But have you found out that men don't really like to go get this checked out?
Usually it's the wives that drag them in the office.
Because their sleep is
sometimes it's the other way around, but more of the time it's the
after the break, we have a question that we're going to come back to, and it deals with how some practical suggestions that you can give our audience of how they might sleep better. Okay? We're going to talk about that after a break, and we want to thank you so much for taking your time to join us. If you want to go to our website, that's heartwiseministries.org. There's some great articles. If you might want to leave a question or have a concern or look at our archived radio or television programs, we want to invite you to go there. We still have time for a few more questions. It's 855-644-3278. We're going to be right back after this break. We're going to talk about ways you can sleep better, so stay with us.
The Heart of Health Live will return in just a moment.
There's a place for modern medicine, but that's not enough. There's a place for lifestyle, but that's not enough. The real truth in medicine, the real truth in healing comes from that relationship with the Heavenly Father. That relationship can show us the balance, when to use modern medicine, when to use lifestyle, and to use it for the right reasons. Well, this book gives the solution to the healthcare dilemma. It answers the question, why am I sick? How do I get better? And how can I have ultimate healing? I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
I'm Dr. James Mark, and I'm glad you've joined us tonight. I'm hoping you're learning something, as I have, from Dr. Kadri about sleep apnea. I really learned something about that snoring that last time, about wearing a pulse oximeter, and I'm going to ask my patients, if I'm curious, to start wearing that. That's a great suggestion. We have another question that's come into our website, and it has to do with someone that wants to sleep better. He says, I have difficult sleeping at night. How can I sleep better? So let's give everyone some suggestions of how they can sleep better.
Well, I think the first thing you have to do is allow yourself to have an appropriate amount of sleep.
Okay.
So a lot of patients come to the office and they wonder why they feel poorly, and they may not have sleep apnea or a sleep disorder, but they allow themselves 4 hours of sleep a night. And for the average adult, 7.5 to 8 hours of sleep. They need to, allow for that period of time and dedicate that time for sleep.
Okay, I'm going to write that down. Allow enough sleep. Okay, that's great. Okay.
Another thing that we want to do is we want to avoid stimulants.
Okay.
Various things that can stimulate you, such as caffeine.
Okay.
A lot of the younger population, video games, and we want to avoid those before sleep. The other thing that we want to do is there are some medicines that we might be on our medication list that can affect our sleep, and we want to avoid certain medicines.
Okay.
I have patients that take stimulants, and they take those later in the day, and they keep them up at night.
What about diet pills?
I think it depends on the diet pill. I think some of those have been associated with insomnia, difficulty falling asleep.
Well, I know some of them have this ephedra in it, and that sort of gets you wired up a little bit.
Right. So anything with any sort of stimulant properties we need to avoid, whether it be consume a certain beverage or medication. We want to avoid that. I think we want to avoid real vigorous. We do want to promote exercise, but I have patients that decide that they want to run 10 miles right before bedtime, and they have a hard time sort of winding down.
Okay, vigorous exercise, I think that's a good one.
The other thing is if we have a mood disorder, the most common causes of insomnia would be stress or certain mood disorders such as anxiety or depression. We want to address those issues and treat that, which will allow for more optimum sleep.
Okay. Now, what do you think about big meals at night?
Yeah, we generally want to we want to avoid consuming large meals anywhere close to bedtime. So at least 2 hours, preferably 3 or 4 hours before bed is when we want to have our big dinner.
Now, some of my people also think it's good to have alcohol before they go to sleep. What do you think about that?
So alcohol is not good to consume before sleeping. It actually physiologically will help you fall asleep, but it causes a rebound, meaning after 3 hours of sleep it causes you to wake up and have difficulty maintaining sleep.
Okay, so we allow enough sleep, avoid stimulants, avoid vigorous exercise, watch mood disorders. That was interesting, because with so many people that have depression and anxiety, that could be a big problem.
Right. So addressing for a lot of people, they have difficulty with managing stress, for example. So there are various stress modification things that we can do, and performing a relaxing activity before bedtime is helpful for most people.
Now, what do you think about under the stimulant category, things like cigarettes? Would that count as a stimulant?
That would count as a stimulant. We also want to avoid other activities in the bedroom. A lot of people now have home offices and they play with their computer in their bed and they watch TV. We want to take those things out of the bedroom because that will interfere with their sleep.
Years ago, before there was Thomas Edison, you didn't hear about all this stuff. We worked at the daytime, when it went night, we went to sleep. But now with all the TV, cell phones, late night food, stimulants, staying up all the time, stress, anxiety, the brain, the sleep centers get all whacked out, no one sleeps good, and then we have all these bad chemical reactions. Sooner or later we have heart disease, diabetes, all these medical problems. I think the real thing we should have done is maybe not invent the light bulb. What do you think?
Well, I don't know about that.
Get rid of electricity.
I have heard someone say that our sleep disorders basically began with the invention of the light bulb.
Wow.
Yeah, there was no need for an alarm clock.
That's right.
Years ago.
Okay. Well, I see we have some more questions that are coming into our website, and you still have time to give us a call, 855-644-3278. We're answering your questions about sleep apnea tonight. But Dr. Kattery is also a neurologist, and we'll have to have him another time back and maybe answer all those questions about neurology. We talked a little bit about that briefly today. We want to invite you, if you want to come to our website, heartwiseministries.org, we'll collect a lot of questions regarding this area and have him come back another time and answer your questions. We're going to go to break right now, but if you still have time, we still have a little bit more time to come in and answer your questions. Give us a call at 855-644-3278 or go to our website, that's heartwiseministries.org. We're glad you're with us. Stay with us. We're going to be right back after this short break.
The Heart of Health Live will return in just a moment.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
Imagine a classroom with no boundaries. A classroom where reenacting a book is an English class, and repairing a motor is a math lesson. A classroom where caring for horses is biology. This is our classroom. At Bachman Academy, 6th to 12th graders with ADHD, dyslexia, and other language-based learning differences are provided a language-rich, hands-on program of study. With an average of 5 students per teacher, Bachman students receive more attention and have more time to learn while using their own learning strengths. Now, imagine your child in this classroom. To learn more about Bachman Academy, visit our website at www.bachmanacademy.org. Bachman Academy, tapping potential one person at a time.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We have some callers that have called in and they couldn't hang on for us, Dr. Kattery, but here's a good question. What medications would keep my husband from kicking and moving? So it sounds like during sleep they were kicking and moving. Any medications might help?
Sure. So most people that have involuntary movements in sleep and in a sort of semi-rhythmic fashion cause arousals, and we call that periodic limb movements in sleep disorder. And the main class of medications that we use are called dopamine agonists.
Okay.
Some brand names that you may have heard of would be Mirapex or Requip. And they work on dopamine receptors in the brain to, usually at very low doses and very well tolerated right before bedtime, will reduce and hopefully eliminate those movements.
Are there many side effects from these dopamine agonists?
Usually in the very low doses that are typically used for this disorder, they're very well tolerated. They can promote sleepiness, and for someone with a sleep disorder that may be acceptable, but they are used for other medical disorders at much larger doses 3 times a day. So.
Right. But it won't make the blood pressure go up or anything like that, like real dopamine?
No, it should not.
Okay. Here's another question. This caller hung up already, but she says, is there a correlation between sleep apnea and weight loss, and can sleep apnea be improved? Can you lose sleep apnea?
Yes.
Okay.
So I think the first question was, is there a relationship between, repeat that
Yeah,
question?
is there a relationship between sleep apnea and weight loss?
Well, having sleep apnea has been proven independently to affect glucose tolerance. So,
Okay.
Independent of your activity. So, people that have sleep apnea, it can cause weight gain.
Okay.
So, the second part of that question is if you have sleep apnea, and there's weight is associated with the sleep apnea, and then weight loss certainly you can reduce your apnea and sometimes even eliminate apnea. So I do have patients that lose weight and are reevaluated and no longer have sleep apnea.
Yeah. Well, here's an interesting thing for us to think about, and for all of us to think about tonight. Right now, it's estimated about 30% of Americans are obese, up to 60% are overweight. And we've already said that, you know, the treatment of sleep apnea might prevent diabetes. So you could make the argument that everyone overweight needs a sleep test for prevention of diabetes and high blood pressure, and they can't lose weight if they can't sleep.
Well, I think asking the questions,
Yeah.
I think in that high-risk population, I think we should have a very low threshold to consider testing those patients. I don't think we should make it across the board, but certainly if they have those risk factors, if the doctor or the patient can speak with their doctor just for 30 seconds about that, I think we're missing a lot of those folks.
You know, Dr. Kadri, right now in the hospital, they have these forms that we have to fill out to sort of screen for sleep apnea. I think that someday, you know, as a part of a routine history and physical, that should be done on everybody. Just like, you know, you heard about cholesterol and blood pressure. They're going to have that sleep apnea right on the list, especially since 60% of people are overweight, and you can't really lose weight if you have sleep apnea very effectively.
Right. It is becoming more of a routine question on the medical questionnaires. One population that's being screened very vigorously now for sleep apnea are truck drivers.
Right.
People that have commercial licenses oftentimes automatically, they're not allowed to obtain their license if they're not screened for sleep apnea. If they have sleep apnea, we have to demonstrate, or they have to prove compliance before they're able to have that license renewed.
You know, I know this is such a rewarding area, at least to see treated successfully. Sure. I had one patient that was treated for sleep apnea, and you know, he was a young fella. I saw him because of atrial fibrillation. Well, once he got treated for sleep apnea, the atrial fibrillation was much easier to control. He had some energy in the daytime. He started exercising. Blood pressure went away. Diabetes went away. His joints started feeling better. He lost a lot of weight in just a short period of time. He got off his depression medicine. I mean, in a short period of time, he was on a lot of medicines that he might have been on the rest of his life just because we got at the cause.
Right, and I think it can be very rewarding, and that's sort of what stimulated me to get in this field, is seeing, you know, it's pretty simple but can make a big difference in their overall health.
Now, has this been associated, sleep apnea, with conditions like dementia and stroke and things like that later in life?
It's certainly at higher risk for stroke. The studies have been well demonstrated. And it has been associated with memory loss.
Yeah.
Any sort of sleep deprivation, not getting enough sleep, is associated with short-term memory problems. And there are now studies that suggest a link to dementia, early dementia, or mild cognitive impairment.
Well, it doesn't surprise me that sleep apnea would cause these things. If your body's under chronic stress 8 hours a day in, day out, month in, month out, year after year, there's going to be a lot of stress on your body, which damages not only, you know, your heart, your lungs, throughout your body. We want to thank Dr. Kadri for joining us. We're going to be back for a short parting statement right after this. But if you might have some questions for Dr. Kadri, we want to invite you to send them to our website at heartwiseministries.org. We're going to be right back after this message with a few closing comments. Please stay with us. We're going to come back after this break.
Heart of Health Live will return in just a moment.
I'm Dr. James Markham, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Have you ever heard things about God that didn't make sense? Have you ever thought that science and Scripture cannot be reconciled? Have you heard ideas about God that scare you? Or are you just tired and confused? If you want answers to complex problems, if you want a testable, evidence-based understanding of God and the world around you, an understanding in which the Bible and science harmonize to reveal the reality that God is love all the time, then Come and Reason Ministries is for you. Hi, I'm Dr. Tim Jennings, board-certified psychiatrist, and Come and Reason Ministries is dedicated to helping you learn to discern, to stimulate you to think, to help hone and refine your ability to know the right from the wrong, the healthy from the unhealthy, and teach you how to experience healing of your mind, body, and relationships here and now. If you would like an evidence-based approach to knowing God, then visit us online at comeandreason.com.
Hello, I'm Joe Coaches. If you enjoy Heartwise Ministry as much as I do, you just might want to become involved. We would first really appreciate your prayer that God would continue to bless and lead this unique ministry. Also, it is very important that you think about becoming a financial partner supporting us so that we can take this message throughout the world to everyone. Thank you.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, we're so glad you joined us this evening and hope you've learned as much as I have about sleep apnea and sleep disorders. Dr. Kadri, thank you for joining us.
Thank you for having me.
And if you could leave one or two parting comments with the world, what would you like to tell them?
I think the fact that sleep apnea can impact so many other avenues of your health, and if you have any sorts of symptoms related to sleep apnea, talk to your primary care physician or a sleep specialist and discuss possible testing.
And I think that's great. And I think it's much better to prevent a problem than deal with a bunch of symptoms with medicines that sometimes don't fix the problem. So I think this has been great. We're going to collect a lot more questions. I know we have some questions that have come in that we haven't answered, but if you'll send them to our website, we'll have Dr. Kadri again, and we'll answer these questions. We want to thank you for joining us. Go to our website, heartwiseministries.org. And we're just glad you joined us, Dr. Kadri, and wish you luck on your practice. I know as a practicing neurologist, sometimes it might not be easy for you to get 4 hours of sleep.
Absolutely.
But I hope you have a good night's sleep tonight. And we hope all you have good night's sleeps tonight well. Thanks for joining us.
Thanks.